Good afternoon, everyone. Welcome to today's episode of Nashville General Hospital's Wellness Wednesday Facebook Live program. Thank you for joining us today. I'm Kathy Poole.
And I'm Kaylin Harris. Our goal of Wellness Wednesday is to introduce you to Nashville General Hospital experts, have them share information vital to your health and wellness, and give you the opportunity to ask questions during the presentation. Joining us today is the Reverend Omaràn D, Executive Director of Spiritual Care Services and Executive Director of CHEN at Nashville General Hospital, as well as Ms. Kristin Clarkson, Program Director of CHEN.
A native of Nashville, Tennessee, the Reverend Omaràn D. Sr. received a BA in English from Fisk University, a Master of Divinity from Lipscomb University, and Clinical Pastoral Education at Tennessee Valley Health System Veterans Affairs. Currently, Reverend Lee is pursuing a doctorate in clinical pastoral therapy with licensure at Memphis Theological Seminary. He is an ordained internment elder in the African Methodist Episcopal Church, the pastor of St. John AME in Springfield, Tennessee, and founder of Reach One, Teach One, a 501c3 organization working with risk youth of Nashville and Davidson County. Ms. Clarkson received her BA from Fisk University, Master of Health Administration from Walden University, and is a current PhD candidate at Walden as well. Kristin is a member of several professional, academic, and community organizations, most recently serving as a junior board member at the YWCA. She currently serves as the program director for the Congregational Health and Education Network, cultivating culturally inclusive engagement opportunities through diverse faith-based and community partnerships that contribute to equitable outcomes. Please welcome our guests.
Hello.
Good afternoon.
So Kristin or Chaplain, whenever you are ready to begin your presentation.
Okay. Well, great. Kristin, would you like to kick off first talking about CHEN?
Sure. What I'm going to do is share my screen, share a few slides with everyone while I give some information and background on the Congregational Health and Education Network. Let me get set here for you. And we will share the screen. All right, can everyone see my screen?
Yes.
Okay, so I'll be giving some information on the Congregational Health and Education Network. CHEN, or the Congregational Health and Education Network, was founded by Dr. Joseph Webb in 2017 here in Nashville, Tennessee. The mission of CHEN is to reduce the health disparities among Nashville's African American community by elevating education attainment and health literacy through faith-based partnership. Our mission is based on the principle that health disparities can be reduced by addressing the social determinants of health and by creating and providing resources that remove barriers that exist in our communities. Our goal is to do this in the marginalized communities of the greater Nashville area, serving their congregational needs, both individually and collectively. So what is CHEN? CHEN is a nonprofit organization that connects our faith-based membership with much needed resources. Now to the next one, bear with me here. Let's see, there are currently more than 100 member congregations in the network with a total of approximately 20,000 congregants. The ways in which we serve these members and congregants is by operating under the 4 pillars of CHEN, which are education attainment, health literacy, access to healthcare, and membership development and maintenance. It is within the framework of these 4 pillars that we seek to continually meet our goals and fulfill our mission. And in this past year, CHEN has really grown, and we've got, even in the midst of COVID, a lot of community engagement and a lot of interaction with the Nashville community. In this past year, CHEN has provided $200,000 in mortgage and rent assistance to CHEN congregants affected by COVID. We've hosted 25 events at member churches and here at Nashville General Hospital during the COVID-19 pandemic, administering just over 1,500 shots of the community, while also providing premier access to the vaccine to the elderly. We have produced the Faith in the Midst of COVID series with 4 virtual educational events in conjunction with the Ad Council. We've established a partnership with the Nashville General Hospital School of Health Sciences to provide educational opportunity to our congregants. And we have also created a digital and print supplemental guide to the faith-based recovery toolkit in conjunction with 3 virtual mental health and substance abuse and addiction events that set 12 of our member churches on the path to becoming certified recovery congregations, which builds their capacity to help persons in their church and community overcome those particular challenges. In concurrence with those activities, CHEN provides concierge access to healthcare services at Nashville General Hospital and Nashville Healthcare Center. Members have access to a navigator who assists them in establishing care, making appointments, and even connecting them to services such as care management and the food pharmacy here at the hospital. As the year comes to a close, CHEN is continuing to provide access to COVID-19 and flu vaccinations and booster shots to the community via our vaccination pods. We are also working on grants with community and educational partners such as Tennessee State University, Vanderbilt University, Meharry Medical College, and the Meharry Vanderbilt Alliance to provide culturally competent information and materials to the community regarding COVID-19 and the vaccine, as well as implementing mechanisms to introduce evidence-based health programs into our membership congregations. We are grateful to have such an active membership and the resources to really drive health equity here in the Nashville community. That's all I have for my presentation. I will flip it back over to you, Reverend Lee, if you'd like.
Kristin, great job in really expressing what CHEN's purpose and what we do with serving our community, serving the faith-based community. That's part of really what wraps into the total package of the mission integration work of the spiritual care of the Faith, Health, and Wellness Division here at Nashville General. The part in which what we do through CHEN is guiding and directing those who are in the faith community to be receiving holistic care. And so a big piece of that, which happens and occurs daily within the hospital, is the spiritual care and what I do directly hands-on with spirituality and patient-centered care. So I'll share my screen here with us for a few minutes and walk through what that looks like for us. So spirituality and patient-centered care and what we do for our patients and what we do with healthcare here at Nashville General is that we're committed to inclusive spiritual care for all of our patients and their families and the staff, and reaching them with compassion and respect for their human dignity. We provide holistic support as the foundation for our hospital spiritual environment. All of that being said is that we're here for the patients, their families, and our staff. Our caregivers are essential to be needing that support and being provided that care, because they're right there on the front lines. If we hadn't seen anything over the past 20 months or so with COVID, the overwhelming issues of health and sickness, we had to be there for our frontline workers who are facing compassion fatigue. And even for, as we work with our partners through CHEN, those pastors and those faith leaders who too were facing it as they were having to bury congregants, as they were having to go to the hospital to be at the bedside of those who were struggling and fighting with COVID, along with the regular reoccurring illnesses that were there, how we could be present. So a couple of things that we were doing during that time period was providing an hour of power for our pastors, for our faith leaders, where we would let them come together and just talk about the things that were on their minds and that were bothering them, that were concerning them in the weightiness of being there as spiritual providers. Part of my work that I'm working on in my doctoral program is looking at caring for the caregiver, pastoring pastors, right? So that's really important. That's central to what we're doing with spiritual care, creating an environment for our faith leaders, for our providers, for our nursing staff, even down to our EVS, to our frontline workers that are facing the obstacles each day, where their spirit becomes weighty from the work that they do. We choose to treat each of our patients that come in the doors as guests, as visitors, as those that are traversing through, that are sick and that are broken, and they need someone to walk right alongside to them. So we like to look at how do we help the hospital in working towards patient satisfaction and their well-being. We look at patients as they're being, when they're diagnosed with chronic or debilitating diseases or life-threatening diseases, that they have to be hospitalized, right? So it's important for us to engage them and to be right there by their bedside, to be right there to share with them. So just to look at a couple of things in unpacking what spirituality is and what is a chaplain, we would define that spirituality is the connection that people make to something beyond themselves as a means of reaching self-actualization. That connection is important. How people reach out and they find something that is beyond or something that is greater so that they can have the will to move forward. Chaplains are the theological and clinically trained healthcare professionals who receive clinical pastoral education and go through supervised training and work towards board certification, obtain board certification to come forth and do this work. And to become a clinical chaplain, it requires that you have training. It's not simply just being a pastor or being a faith leader working in a pulpit or parish ministry. We look for persons that have a master's of divinity, that have ordination endorsement from their official group, and go on to complete clinical pastoral education. And that's 1 unit, internship and residency of 4 units. We've just now started our internship process working with Ascension, where they send us feeder students to do their 1 unit. And they're here with us for 20 weeks, doing 15 hours a week, doing rotations, going to be present with patients, meeting with staff members, and charting in our EMR, getting the proper training they need to learn how to be present with those that are in need. So we help patients by providing, chaplains are available to provide the spiritual care and emotional support during their hospitalization, an active and empathetic listening ear. We pray with them before procedures, and we support their families or their friends. And we try to, if we don't have it here, the particular faith that they need or support system that they need, we like to reach out. And that's where also the other part, the next tier of connecting with our congregations in the Congregational Health and Education Network, we reach out to their faith traditions to bring in someone that is what we would call a subject matter expert in their particular faith, to help those persons learn to cope, help those persons to process their healing that they need to go through while they're facing their sickness here in the hospital. Faith and health work hand in hand with each other, and understanding that is key when we're trying to work at healing the whole of the persons. Chaplains help to provide a connection to the patient's spiritual need. We communicate to the doctors and to the nurses their fears and their questions and concerns, because as we talk about bedside manner, we talk about health literacy, there are pieces in which that we want to make sure when we visit with the patient that we know that they understood what the doctor is saying that the procedure would be, or what the prognosis may be, so that the patient can play an active role in what's going on in their medical care. We provide that intercession for the staff, and when we attend to the spiritual needs of the patient. And what's important from there is that where we go and we integrate with the interdisciplinary team, we round with the doctors and with the social workers, and we receive feedback from them and share with them feedback that we get from the patients, so that everyone can work in concert to help the patient get the proper care. And so we also, as we talked about earlier, support the staff that are having spiritual struggles. The work that medical providers do, frontline essential workers do, is so taxing. And when their spirits are heavy and weighty, it can cloud how they govern and support the patient that is there in the bed. By doing that, by us being present with them, then it also, on the other hand, helps us to help Nashville General and other hospitals where they're chaplains serving, to improve the press gaining the healthcare provider system, the HCAP scores, because now we're able to check in with the patient. We're able to encourage them and encourage the staff to seek best help possible. So how does spirituality work within patient-centered care? Well, first, the clinicians have to be comfortable with their own spirituality. Whether you believe or not, we want you to be comfortable with where you are. And that's acknowledging that the patient's rights to spiritual care is 70% of the patients will have a belief system. So you don't have to be a person of faith to understand that the people that you attend to may have spiritual concerns, and they're wanting those to be nurtured and catered to. We try to impress upon our doctors and our providers that it's okay for them to be intentional about addressing spiritual needs. We share with our residents in presentation that it's okay to have a clear mind when they're entering the patient's room, and be present with the patient at their bedside, listening and open to the patient, open to spirituality while remaining true to the medical training that they're providing. It's okay to ask, would they like to see the doctor? Would they like to see the chaplain? Would they like for the chaplain or to come by to pray with them? And understand that it's where their care starts and where spiritual care begins, where theirs ends and where spiritual care begins. So that's pretty much in a nutshell of what we do with spiritual care and how patient-centered care is encompassed spirituality and how we try to fuse them. The greater part of what we try to infuse with spiritual care, with the faith, health, and wellness entire division, is taking the community, taking the hospital, and all working toward blending the mission of what we do in serving our patients, taking care of their whole self, providing for their spiritual needs, and every patient, one patient at a time, each and every day. So thank you, Kathy and Caleb, for giving us the opportunity to share how work that we're doing is meaningful and impactful to Nashville General patients.
Thank you, Chaplain Lee, and thank you, Kristin, for explaining more about how CHEN operates in the background and the purpose of CHEN, but then also how does spiritual care work? Because I think a lot of times when you think of a hospital chaplain, where you're going and, when you come into a hospital, it's such a high stress situation. And I think a lot of times people, you want to have someone that you can reach out to and talk to and pray with or speak with, but sometimes there's certain barriers in that conversation. So I love, Chaplain, that you mentioned that you bring in, depending upon, the patient's religion, you will bring in their clergyman or bring in their clergywoman to speak with them. I think that is, part of the personal touch and that community aspect that really encompasses who CHEN is as a body. So I really, really love that. So I had a quick question. I definitely wanted to ask this. So does a chaplain only work with patients? Or who exactly does a chaplain speak with?
That's a great question, Caleb. The chaplain, and when we speak in the hospital setting of the chaplain works with the entire body that's there, both the patient, their families, and the staff. I've been coaching my colleagues that are pastors that when you think of a chaplain, think of them as that the place in which they serve, the staff that's there, that's their congregation. And the patients that come in, they're the visitors. Think about it, when we go to a church or we go to our house of faith, our particular one that's germane to us, we're members there, right? And so anyone that comes as a visitor, they're coming for a couple of reasons. They're looking for a place, they're lost, they're wanting some questions answered, they feel outside of the norm, they're spiritually sick. And so those are the pastors through that you're trying to help to bring into full connection or bring into full support. But the persons that are there every week, Sunday after Sunday, the employees in the hospital that are there day over day, week after week, who are, this is a very big part of their life, they are the members. So the chaplain serves both the staff and the patients that come in. And in a system like ours, where as we're growing, we're hoping to have more chaplains on staff at some point, but with the audience in which we serve, it's imperative that that spiritual care department and the chaplaincy really serves the staff, because then from there, when the staff spirits are all right, when they're centered, they can help spread good faith, goodwill, and support much further, because you have more hands touching more lives and helping to make things better.
Beautiful. And I love that you spoke about the importance of spiritual care. You know, what does that mean? What does that look like? And you were able to dive into that. But I wanted to ask, so I guess a segue into my next question. So what are some ways to develop or to develop your spiritual care, or to process, like, how do I develop that part of myself? I think that a lot of times we know how to develop ourselves physically, we know academically, we know emotionally, but when it comes to spiritually, and every religion is definitely different. But what would be your top 3 ways that if someone was saying they're trying to, process that part of their healthcare plan?
Well, I don't know if I could say it in the top 3 ways, but what I would say though, Caitlin, is that think about spirituality as like a muscle, a virtual muscle. Now, you know how to work out, right? If you practice lifting weights, you get stronger, you build up the resistance where you grow muscle. If you do crossword puzzles, that mental muscle, your brain gets stronger and is able to analyze things a little better. And so if you practice and work at it, it only gets stronger. So in practicing spirituality, there's a few things you can do. There's meditation, there's reflecting on spiritual-based writings. For Christians, it would be the Bible. For Muslims, it would be the Quran and the Bible. For Jewish persons, it would be the Torah, and it would be for Hindus, it would be the Bhagavad Gita. I think that's what it is. But so that there are different books in which that you would reflect to find a connection to help you walk closer with a spiritual understanding. There's breathing exercises that you can do. And along with that, working at mindfulness. Those types of things, learning to sit and just be still, with journaling, writing your devotion. Those exercises help to get you to a centered place, so that what I like to look at is a theocentric life. You can be like yourself, a multimedia brand designer, right? You're called to that. And that in the way that I would treat that in a theocentric world is that God has to be in the center of your calling, which is to create brand designs. And so then you look at what works within your moral scope, how that feeds into what you put into the community and what you get back from it. So starting with, I guess if we say there's one piece you do, you start with a theocentric base, that God being the center of everything. And then from there, you work to keep God in the center of all that you do. You keep your focus on how you grow and strengthen that muscle, that spiritual muscle.
Thank you. And Ms. Kristin, I do have a question for you. So I know that CHEN is very community-based, and even Reverend Lee just referenced that, the community aspect, and even your spiritual care. So if someone wanted to donate to CHEN, or if someone wanted to volunteer with CHEN, what would be your recommendation for starting that? And if CHEN is accepting volunteers, what does that process look like, if, for any of your events?
Well, what we like to say is just reach out and connect with us. We are always open. We are always here. Phone call, email, through our Facebook page, CHEN Nashville. Just reach out to us and I will get back to you immediately. We are always accepting help. We are also always accepting donations. However, when someone wants to really support their community and they want to donate, whether that's time or whether it's money, we are always open to that. We have a very active membership and we have a lot of participation from our health liaisons, which are persons within the church that we connect with, and they then spread the information to the larger congregants, and they are really honed in and really do believe in the program. So if anyone is willing to participate or willing to donate, just give me a call or an email, send a dove, I will be there to answer the call.
Thank you.
And on that, as far as with the congregations, so if they just go to the website, they'll be able to see whether or not their own church is affiliated with CHEN. And if it isn't, how can they get the ball rolling? Do they need to go to their pastor first, who then needs to connect with you? And then what if they are a member and they become a patient here at Nashville General? Are there certain things when they come in, they need to say, hi, I'm a member of CHEN? Do you have any additional information about that?
Sure. So we do not post a list of all the churches that are in our network. Like I said, we have over 100 churches within our network. I would hope that those that are in our network are aware. If they are not aware, they can go to their pastor and inquire, and that pastor can reach out to us. Joining us is simple. Again, it's a contact piece. Right now we're in the midst of putting together our own separate website, which should be up and running within about a week or so. In the meantime, like I said, contacting me via phone or email works, as well as the Facebook site. And membership is just identifying the pastor, who will then identify the health liaison. And at that point, they're put into our contact list, and we are sending resources, events. They can share their good news and events with us, and we will share that with the community. We connect them to our community partners, which everyone in Nashville is so connected and so ingrained in the community. We really have a great support system. So it's, again, very easy. Just contact me and I will take care of it. As far as coming to the hospital, if they want to, if they are not part of, if they're not already a patient, they can, again, contact CHEN and we will walk them in what we like to call the white glove service. So people reaching out and trying to navigate the healthcare system can be confusing. Even someone like me who works in healthcare, sometimes I'm getting transferred around when I call places to make appointments, and I don't know who I need to talk to. What they're getting with CHEN is that person who's going to help them navigate that process. They're going to help them with their insurance. They're going to help them determine what it is that they need, who they need to see, and if they need financial assistance, we're going to help them with that. So we're going to navigate that, get their appointments set, and make sure that they are comfortable with what they're doing. We're eliminating those barriers for them, as we talked about. So social determinants of health, whether it's a language barrier or a literacy barrier or even a health literacy barrier, we're here to assist with that. And if they're coming straight through CHEN, we're going to ensure that in the system they are designated as a CHEN member. If they come in and they may already be a patient, when they come for their services and they're doing check-in, they can say, yes, I'm a member of CHEN. If they're unsure, they can simply say, well, I attend such and such church, and our staff is trained, and they have a list of all of our churches, and they can then designate them as a CHEN member in the system, and they will have access to the resources of CHEN. So I hope I answered your question, all of them.
Okay, and then Reverend Lee, can you talk about how the spiritual care division fits within the mission of Nashville General Hospital?
Absolutely. When we think about the mission of Nashville General, we think about what the purpose of Nashville General is here is to serve our community, serve the persons in our community that are underserved, and to train our doctors and to make new healthcare providers that are able to go forth and to make things better, easier for bringing science and medicine together. Our piece of that is that there's a spiritual linkage. When we're primarily talking about underserved communities and those where there's high poverty rates, or those where there are barriers based on the social determinants of health, there's great mistrust that's there. And the persons in which that they trust are their faith leaders. And so for us, in supporting the faith leaders by showing them how great of a service that we have here, and integrating the faith community to what Nashville General's mission is of serving and caring for one neighbor at a time. What we're able to do then is to move the needle to a healthier community. We're able to mitigate those social determinants, the outcomes of those. We're able to stave off for persons who once didn't have access to healthcare or didn't have proper education, or was lacking in ability to be upwardly mobile. We can help them find a way to get into our School of Health Science so that they can earn certification, which is going to ultimately place them in another bracket of earning potential, which opens doors then to better housing, opens doors to health insurance, opens doors to food, to erase food insecurities. So Nashville General's mission is so interwoven into what we do faith-wise in the city and the community of Nashville. It's intricate that we both work in concert together to help change the outcomes of every patient that walks through our clinics and comes in to spend time with us in our hospital beds.
Speaking of walking into the clinics and spend time with us in our hospital base. So what advice would you give to someone who is, I'm going to paint the picture, someone who is here visiting a family member and they are just moved by the Spirit? They are, they may be a reverend, or they may be a Bible study leader, and, they want, to go and visit other rooms, or, they want to, speak to patient, and it's, a conversation in the lobby is one thing, but if they're, on one of our floors and they're pretty much walking around and going through, that they're doing those motions. So what advice would you give to someone out there who's just like, I'm either ready to be a chaplain myself, or they're just, in a situation where they just, move by the Spirit is what we go call it.
Kaylin, I appreciate that question. And what I would say, any person that is that on fire to serve and care for people that are sick and that are in the hospital and want to share their love for whatever their faith base is, I encourage them to reach out to me, and anyone that comes across them to redirect them to me so that I can help them understand our process and our order. What we have to understand about spirituality and faith and persons that are in the hospital, that are sick and that are fighting maybe a lot of times for their lives, what we don't want them to feel is that there is pressure about how they accept God in whatever faith or belief system that may be. We want persons to feel that this is a place where they can find rest and that they get the opportunity to be made whole. You may very well be a person that doesn't have a faith system and hadn't had the opportunity to explore it, or have, and find that it's not for you. So we don't want anyone to make you feel uncomfortable. So I encourage any person that's wanting to share their love for God in whatever vernacular that may be, reach out to me, and I will be glad to help you tailor that to what works here for us at Nashville General.
Well, thank you. And I think that is a good enough spot to end this interview today. I think that is perfect. Thank you very, very much, Kristin, for being on today, and Reverend Lee. We really appreciate learning more about spiritual care here in Nashville General Hospital, what and who a chaplain is, and your operation, as well as CHEN, and learning more that this is a great vessel in a way that Nashville General Hospital is able to connect to faith-based communities. So Thank you all again for being on today. And if any of our viewers have any additional questions, please continue to either comment in our chat box or feel free to send Nashville General Hospital a message, and we will be sure to give it to both Reverend Lee and Kristin at a later time. And you can also visit nashvillegeneralhospital.org/CHEN to find out more information about our spiritual care process and the CHEN program.
Thank you to everyone who joined us today, especially you both. On behalf of Nashville General Hospital and our Nashville Healthcare Center, we wish each of you a warm, happy, and healthy holiday. We'll see you again in 2022.
Everyone, thank you.